Hello, welcome to any community. In this particular video, we are going to decode the quotes by the experts in the field of Ayurveda. How this quote will be helpful in developing our own concepts or building our own uh, practical experiences. How that can be learned in a methodical way that we are going to discuss in this particular video. When you think about the quote as such. So that is actually they are going to give their statements based on their life experiences. Maybe some of them may get that particular experience in a matter of 5 years or so. Some others may get that particular experiences in a matter of 10 years or so. Some are getting that particular experiences 30 or 40 years later as such. So when you think about when you are planning to go in that particular way, we may reach the destination even much faster. And one such expert is Professor G Srinivas Acharya, former principal, SDM College of Ayurveda, Putpadi, Udupi. He used to say that diagnosis is the key. Make the diagnosis first. Let land, let it be as accurate as possible, and do the treatment later. So this is the statement usually given by the late Dr. G Srinivas Acharya. And when you decode this particular statement, so diagnosis is nothing but identifying the disease. Which particular illness or the discomfort or disease the person may be suffering from. So that is identifying that. So when you decode this, there may be a possibility of discomfort. So in that particular situation, what is dosha is being afflicted? Whether is it sharirika dosha or manasika dosha? In terms of sharirika dosha, whether is it vata dosha is affected or pitta dosha is affected or kapha dosha is being affected. And in case of the manasika dosha, whether it is rajo dosha is being affected or tamo dosha is being affected. For example, the person is suffering from cough with yellow colored sputum. In the sense, there may be a possibility of a dosha affliction in that particular situation could be vata and pitta. Plus, to some extent, even kapha dosha may also be associated. And when you think about the presence of pain in the pricking type of pain in the abdominal region, naturally it is considered to be vata dosha is being affected. And when the person is having the unstable thought process as such, where he is not in a position to have the concrete thought process, which is not aligned with one's values and belief systems, naturally we are going to say that the person is having the rajo dosha dominance. In that way, dosha vitiation has to be analyzed. And dosha affliction. So we have to know about which particular dosha is being affected. Among the dosha in the sense, it is dhatu and mala. Whether which particular dhatu is being affected, whether it is rasa dhatu or rakta dhatu or mamsa dhatu or medo dhatu or asti dhatu or majja dhatu or shukra dhatu, affection is there or not. And in case of the mala, whether is it mutra, purisha, sweda, as the pitta, kamala, etc., that is being afflicted or not, that has to be noted. All these can be understood by noting about the nature of a clinical presentations in the individual. For example, if the person is having the skin eruptions, it is indicative of the affliction of rakta dhatu only. And if the person is having the joint pain, we may suspect there may be a possibility of affliction of asti dhatu. If it is a chronic one, there may be a possibility of majja dhatu affliction also can be observed. In that way, dosha affliction has to be analyzed properly. Then next comes the Bahya Srotas affliction. We know that the 9 Bahya Srotas are present in males and 12 Bahya Srotas are present in females. So we have to know regarding the which particular Bahya Srotas affliction is being present. Is it the mouth? Is it the nose? Or is it the eyes? Or is it the ears? Or is it the anus? Or is it the urethra? Or is it the vagina? Or is it the breast tissues? So like that, the Bahyasrotas affliction has to be observed. How to identify the Bahyasrotas affliction? For that, you have to know about the presenting complaints in relation to Bahyasrotas. For example, if the person is having the sneezing, that is indicative of the recent affliction of a nasa. And if the person is having the itching around the eyes, that is indicative of the affliction of Bahyasrotas. In this particular occasion will be Akshi or eyes. In this way, so we have to know at least the Bahyasrotas affliction. To know about it, at least ask one question related to the Bahyasrotas affliction as such has to be inquired. Then regarding the Abhyantara Srotas affliction, again this can be analyzed by noting about the proper Lakshana itself. Regarding the Abhyantara Srotas, whether is it Pranava Srotas affected, or Udakavaha Srotas affected, or Annavaha Srotas affected, or Rasavaha Srotas affected, or Raktavaha Srotas affected, or Mamsavaha Srotas affected, or Medovaha Srotas affected, or Astivaha, or Majjavaha, Shukravaha Srotas affected, or Mutravaha, Purushavaha, Svedavaha Srotas affected, that has to be identified by looking into the specific Lakshana itself. For example, Adhyastidanta Udantasti Vedashulam Vivaranata Keshalam Manakashmashtu Doshashasti Pradoshaja. When you are observing these Lakshana, we may suspect the Asti Vahasrotas affliction. Rukparvanam Brahmo Murcha Darshanam Tamasastata Arusham Stulamulanam. If you are observing these Lakshana, we may suspect the affliction of Majja Vahasrotas as such. Next, regarding the analysis of Nidana exposure in the individual. For example, if the person is having the exposure to dust, in the sense the most probable Srotas affliction in this particular occasion could be Pranamaha Srotas. That has to be, for that reason, analysis of Nidana exposure is essential. If the person is exposed to Shita Jala Sevana, it is Pranava Srotas plus Annamaha Srotas affliction may be observed. If the person is taking the cold water bath, in that particular situation, it is not the Pranavaha or Annavaha Srotas, it is the Rasavaha and Raktavaha Srotas affliction can be observed. In this way, analysis of Nidana exposure has to be done, wherein we are identifying whether is it Sannikrishta Hetu or Viprakrishta Hetu or Vicharya or Pradhanika Hetu, or whether is it Asatmindriyartha Sanyoga or Pradnyaparada or Parinama, or whether is it the Dosha Hetu, Vyadhi Hetu or Ubhaya Hetu, or whether is it Utpadaka Hetu or Venjaka Hetu, or whether is it Anubandhya Hetu or Anubandha Hetu, or whether is it Bahya Hetu or Abhyantara Hetu. Whereas in terms of the Abhyantara Hetu, whether is it Vriddhi Sthana or Kshaya, or whether is it Shakha Marmasti Sanja or Koshtha, or whether is it Chaya Prakopa Prashama, or whether is it Urdhvagati, Adhagati or Tiryagati, or whether is it Sama or Nirama Gati, etc. In that way, the analysis of Nidana has to be done extensively. Then we are talking about the Vyadhi Avastha. Vyadhi Avastha in the sense, the stage of the disease, in the sense we are noting about the status of the dosha or dushya or srotas, etc. Or we are going to note about the status of the rogibala, or we are going to note about the status of the exposure of the nidana as such. So like that, all these are helpful in determining the vyadhyavastha. For example, if the person is having the exposure to rajaha sevana, naturally, so that will be responsible for the, what do you say, that pranavasrota affliction. Rajaha Sevana or dust exposure may be considered to be a type of Vyanjaka Hetu, or it can be considered to be responsible for the, what do you say, that the Adi Atmika Vikara, Adhyatmika Vikara. In that way, Vyadhyavastha is helpful in noting about the actual state of the health status of an individual. If the person is going to consume frequently Adhyashana, naturally the affliction observed will be related to Annavaha Srotas as such. In this way, Vyadhyavastha may be helpful in determining the Vyadhi Vinishtaya. And how to identify the Vyadhyavastha there? By noting about the proper case history, or by doing about the accurate physical examination, and by suggesting the possible laboratory investigations as such. In this way, we are going to analyze the Vyadhi Avastha. Then comes the assessment of Samprapti. Assessment of Samprapti in the sense, let us say, example of Ukalpa Samprapti. Based on the Nidana, which particular guna increased is there or not, that has to be observed by looking into the Samprapti itself. For example, if the person is going to consume Shitala Jala Sevana, then we are going to expect the Shita guna increase in the body. Suppose if the person is going to consume the Gobi Manchurian as such, we are going to suspect the affliction of Pitta dosha vitiation as well as Vata dosha vitiation in due course of time. So like that, assessment of Samprapti has to be done to know about the accurate diagnosis of the disease as such. Now, let us look into these different parameters with an example. So, regarding the dosha vitiation observed, in this particular occasion, the person is having the swelling of the left knee joint, and it is associated with redness also. In this particular occasion, the dosha vitiation may be observed here could be Pitta Kapha, and if it is associated with pain, which is not evident at present, so then we are going to suspect the vitiation of Vata dosha also. Then comes regarding dusha affliction. As the person is having the left knee joint pain, here we are going to suspect the dusha affliction could be asthi and majja. Majja suspicion can be done if the person is suffering from chronic joint disease. In this way, dusha affliction can be considered. As far as bahya srotas affliction are concerned, so here the bahya srotas affliction is a little bit difficult to predict because the person is having the swelling of the left knee joint. That is the reason here the difficulty in bahya srotas affliction can be observed. Whereas abhyantara srotas affliction, so here abhyantara srotas affliction could be Astivah Srotas and Majjavah Srotas. And when the individual is having Asti affliction, then we may suspect the person is having Astivah Srotas Dushti. And if we are observing the Majja Dhatu affliction, then we may suspect the person is having Majjavah Sroto Dushti as such. As far as analysis of Nidana here considered, probably the exposure to left knee joint, maybe a trauma or maybe excessive walking, etc. There may be a possibility of the swelling of the left knee joint. And here one possible cause could be excessive walking. Here it may be responsible for the Agantuja dosha as such, Agantuja hetu exposure to the body. As far as Vyadhyavastha is concerned, here it may be considered to be the Sama stage because the person is having the swelling and redness as such. As far as the disease is concerned, probably it could be Adhyatmika Vyadhi as such. and that too, it could be categorized under dosha bala pravruta vikara. In this way, the Vyadhyavastha assessment can be done. As far as how to identify Vyadhyavastha, so here we have to inquire with the patient regarding the joint pain, regarding the joint swelling, chronology of the development of the symptoms as such, regarding the location and radiation of the joint pain, regarding the severity of the joint pain, regarding the aggravating and relieving factors of the joint pain, and regarding the uh, assessment of the Kriya Kala as such. So here it may be categorized under the Vyakta Avastha also, and an assessment of Samprapti lastly. When you think about the Samprapti, Vikalpa Samprapti, Pradhanya Samprapti, Bala Samprapti, and Kala Samprapti. So these are the further subtypes of Samprapti that may be helpful in making the diagnosis as such. And as far as Bala Samprapti is concerned, if the person is having the bearable pain, he can do his routine activities. In that particular situation, Roga Bala is Mrudu and Rogi Bala, Rogi Bala is Pravara. Whereas if the person is having the more severe pain and he is not able to do his routine activities, disturbing his routine schedule, then we may suspect there may be a possibility of Rogabala. More assess the severity of Rogabala will be more and Rogibala is less. In this way, the assessment of Samprapti may be helpful in making the clinical diagnosis. As far as the same example regarding the dosha visheshana, as we have discussed earlier, dusha, asthi and majja, bahya srota affliction is difficult to predict here, and abhyantara srota affliction, here it may be asthi vaha srotas and majja vaha srotas as such. As far as Vyadhyavastha is concerned, it is categorized under Vyaktavastha, it is categorized under Madhyama Roga Marga, it is categorized under Vata, Kapha, and Pitta dominant disease. As far as Dhatu affliction is concerned, it is categorized under Astivaha and Majja Dhatu affliction. As far as Srotas affliction is concerned, Astivaha and Majjava Srotas affliction can be considered. As far as the Roga Marga is concerned, it is categorized under Abhyantara Roga, Madhyama Roga Marga as such. So, like that, the Vyadhyavastha can be considered as such. As far as identifying the Vyadhyavastha here, so here we are supposed to make the musculoskeletal examination first. That too, we are going to concentrate upon the knee joint examination first. That too, left knee joint examination. And we are going to analyze what kind of the disease a person is having. Whether is it Adhyatmika Vikara or Adibhautika or Adidevika Vikara, that can be considered there. As far as an assessment of Samprapti is concerned, so here we are going to identify the what kind of the Sankhya Samprapti is being affected here. What is the Vikalpa Samprapti is being affected here. As the person is having the redness as such, so here we are going to suspect the Vikalpa Samprapti as there may be a possibility of Ushna, Tikshna Guna increase in the body. In this way, assessment of Samprapti can be done. So regarding the means to achieve these diagnostic criteria, first we have to do the structured case taking, in the sense the methodical case taking in terms of preliminary history or the preliminary data, in terms of the chief complaints, in terms of the associated complaints, in terms of history of present illness, in terms of previous history, in terms of treatment history, family history, personal history, in case of females, menstrual and obstetric history, socio-economical history, and occupational history may be helpful in determining the actual diagnosis of the disease as such. Then we need to do the proper methodical physical examination. in terms of Trivida Roga Pariksha, in terms of Shadvida Roga Pariksha, in terms of Ashtasthana Pariksha, in terms of Dashavida Athara Pariksha. So methodical physical examination has to be done, and methodical analysis of Samprapti has to be carried out. First and foremost, identify the prakriti of the individual. Whether is it considered to be the physical parameters, or whether is it emotional parameters, or mental parameters, or social parameters, or spiritual parameters, that has to be analyzed. Regarding the dosha afflicted, what kind of the dosha is being affected? Whether is it Sharirika dosha or Manasika dosha, or whether is it the Vruddha dosha or Kshina dosha, etc., that has to be analyzed. As far as dosha affliction is concerned, what kind of the dosha is affected? Whether is it Rasadhatu or Rakta Dhatu or Mamsadhatu or Maido Dhatu, Asti or Majja or Shukra Dhatu is being affected or not, that has to be analyzed. Dosha affliction, in the sense which particular dosha is being affected, whether is it Bhashya dosha or Abhyantara dosha. Bhashya dosha in the sense Vata, Pitta and Kapha dosha, and Abhyantara dosha in the sense Rajas and Tamo dosha has to be analyzed. And methodical analysis of Samprapti here. As we have discussed Prakriti, then we need to know about the dosha as such. Then we are going to know about the dosha afflicted. What kind of the dosha is being affected? Whether is it Uttana dosha or Gambhira dosha? Among the Gambhira dosha, there is it Medo Dhatu is affected, or Asti Dhatu is affected, or Madhya Dhatu is affected, or Shukra Dhatu is being affected. Regarding the Srotas affliction, there is it Bahya Srotas is being affected, or Abhyantara Srotas is being affected. And regarding the Roga Marga afflicted, depending upon the nature of the presenting illness as such, which particular Roga Marga is being affected, that has to be analyzed. Whether is it Bhakhyadara Roga Marga is being affected, or Madhyama Roga Marga is being affected, or Abhyantara Roga Marga is being affected, that has to be analyzed. And Vyadhyavastha of an individual. What kind of the Vyadhi an individual is suffering from? In case of the Atisara, whether is it Ama or Pakwa Atisara, that has to be analyzed there. And if the person is having the pain in the left knee joint, there is it non-inflammatory or inflammatory, that has to be properly analyzed. And regarding the Agni assessment and Ama assessment, as far as the Agni assessment is concerned, that is the Udgara Shuddhir Utsaho Vegotsargo Yathochitah Lagodakshi Pipasaja Jirna Harasya Lakshanam. Whether the person is getting the Jirna Ahara properly or not, that has to be analyzed. As far as Ama definition is concerned, Srotorodha Balabhramsha Gaurava Anila Mudata Alasya Apaktanishya Maladhangar Shuklama. If you are observing these lakshanas in an individual, then we may say that the person is having the presence of Ama in the body. And Sadhya Sadhyata assessment, that has to be done by noting about the Darshana, Sparshana, Prashna, etc. etc. And we are going to note about the Dosha afflicted, Dusha afflicted, Srotas afflicted, Srotodushti afflicted, and Udvasthana, Sancharasthana or Vektasthana, that has to be analyzed while looking into the Sadhya Sadhyata assessment. To summarize, one of the experts in the field of Ayurveda, he says, that late Dr. G Srinivas Acharya says, diagnosis is the key. Make the diagnosis first and do the treatment later. So here the treatment, in the sense, we are going to make the dosha or pathogen present in the intracellular compartment to interstitial compartment, then to intravascular compartment, then to the alimentary canal, and later that will be eliminated either via Vamana or Virechana or Basti. In this way, we are going to note about the decoding the statement given by one of the highly appreciated, renowned expert in the field of Ayurveda, late Dr. G Srinivas Acharya, former principal, STM College of Ayurveda, Kuppadi, Udupi, Karnataka. Dear ANA community, what are the major key takeaways from today's discussion? Mentioned in the comment box below. What is the one video that you'd like to hear in the coming days in this particular channel? Mentioned in the comment box below. and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's what for today. Something more in the next video. Thank you.